Welcome to Dental Hive's Dental Reception Basics. In this series of resources, we will present topics that provide the foundations for working as a dental receptionist in Canada. These resources are intended to help onboard new dental receptionists and also act as a refresher for your current team members. Today, we are discussing the difference between calendar year, benefit year, and rolling sums in regards to insurance benefits. All insurances, whether through an employer, an individual plan, or a healthcare spending account, will have an insurance policy year. This is a 12-month period of benefits coverage. This 12-month period may be a calendar year, a benefit year, or rolling sums. A calendar year is exactly how it sounds. It is a one-year period that begins on January 1st and ends on December 31st. Benefits will renew every January 1st, and the full dollar amount will be available again. Certain procedures may not renew. For instance, if the plan has orthodontic coverage, you might see a lifetime maximum instead. This means that the plan has a certain dollar amount per the patient's lifetime, and it will not renew every year. In certain cases, you may also see that on major treatment as well. For example, they might have $10,000 of major coverage per the patient's lifetime. In both these cases, the calendar year does not apply. Frequencies also do not follow the calendar year normally. You will see certain frequencies, like recall every 6 or 9 months. Those frequencies need to be followed regardless of the maximum renewal. January 1st does not mean they are eligible for a recall or polish suddenly because their plan renews. Look at the last time those codes were billed and follow the frequencies. In most circumstances, maximums do not carry forward to the next year. The term use it or lose it applies to most insurances. If the patient does not utilize their insurance or maximums by year end, they lose the option once the insurance resets. A benefit year is 12 consecutive months following the effective date. The start date could be any day, but normally falls on the first of a month. For this example, we're saying the benefit year starts on May 1st, 2023, and runs until April 30th, 2024. Benefits will renew every May 1st, and the full maximum becomes available. Similar to the calendar year, certain procedures and frequencies will not renew, and maximums will usually not be carried forward into the next benefit year. Rolling sums are a little bit more complicated. They are similar to a benefit year, except rolling sums are always changing. The 12-month rolling sum is the total amount from the past 12 months. So benefits are in fact for 12 months from the date of each procedure, no matter when that occurs during the year. For this example, we'll be using scaling units, since reception will find this is the most common procedure that uses rolling sums. In this case, a patient has 10 units of scale every 12 rolling months. They have an appointment for a cleaning on May the 1st. Will they be covered? To figure this out, we can either send an estimate or take a look at the patient's history from the past 12 months. They came in for their last cleanings on May 3rd, 2022, where 3 units was used, September 3rd, 2022, where we used another 3 units, January 3rd, 2023, another 3 units. So that means if they were to come in on May 1st, 2023, only 1 unit would be available since we've already used 9 in the past 12 rolling months. For full coverage, the patient would need to wait until after May the 3rd, 2023, because that is when 3 more units will become available. This will be the same for any procedures on rolling months or years. If a patient is covered for a complete oral exam every 3 rolling years, you look back at the time it was done, and then you can calculate and say, you had the exam done on April 24th, 2020, therefore you're eligible today for another. Once again, all insurances, whether through an employer, an individual plan, or a healthcare spending account, will have an insurance policy year. Once you, the dental receptionist, determine the 12-month period of benefits coverage, you should have the confidence to figure out maximums, coverage, and eligibility. This resource is brought to you by myself, Felicia Sprague, and I am one of the co-founders of Dental Hive. We're changing what hiring, onboarding, and building teams looks like. We're bringing teams together and connecting the clinic with the wider dental network. Thank you for watching, and keep checking back for new resources, helpful training, and guides.